How is keyhole craniotomy less invasive? Imagine being able to remove a brain tumor through a tiny opening instead of a large cut in the skull. That's what a keyhole craniotomy offers. It's a surgical technique that uses a much smaller opening in the skull compared to traditional methods. This small opening reduces damage to the surrounding tissues like the scalp, blood vessels, nerves, and brain itself. Because the opening is so tiny, often just as small as a keyhole, it minimizes trauma during surgery and often results in less scarring. One of the main reasons a keyhole craniotomy is less invasive is because it avoids the need for large bone openings. Instead of a big window in the skull, surgeons create a small hole, sometimes just a few centimeters wide. This means less disruption to the skull and less tissue damage overall. The smaller incision also means less pain after surgery and a quicker recovery. Patients often stay in the hospital for just 1 or 2 days, compared to 5 or more days with traditional surgery. Another key benefit is that it involves less manipulation of the brain. Surgeons use advanced tools like endoscopes, which are thin tubes with cameras and lights. These tools provide a clear, magnified view of the tumor and surrounding structures through the tiny opening. This precise visualization allows surgeons to target the tumor accurately without pulling or retracting the brain tissue. This reduces the risk of injury to critical areas that control functions like vision, speech, or movement. Because the approach is more direct and less disruptive, there is also a lower chance of complications such as bleeding, infection, or wound healing problems. The smaller incision and less tissue trauma mean fewer risks of cosmetic disfigurement and less post-operative discomfort. Plus, because the surgery is less invasive, patients often experience fewer side effects and can return to their normal activities sooner. Keyhole craniotomy is especially useful for tumors located at the base of the skull, near the pituitary gland, or deep within the brain. These areas are difficult to access with larger openings, so the minimally invasive approach helps preserve brain function and reduces overall surgical risk. In the context of brain health and tumor treatment, keyhole craniotomy offers a way to remove tumors effectively while minimizing the impact on the patient's body and brain. It's a significant step forward in neurosurgery, aiming to improve outcomes and quality of life. However, it's important to remember that not every tumor is suitable for this approach. Patients should always consult with experienced neurosurgeons who can evaluate their specific case and determine the safest, most effective surgical plan for their individual needs.